Dr. Witham, it's an honor to speak with you. You recently performed the first augmented reality guided spinal surgery in the world at John Hopkins Hospital. Can you please talk a little bit about the procedure and your experience with the surgery?
Yeah, thanks very much, Aarti. Thanks for the opportunity. Yeah, so, I was fortunate enough to be a part of a team working with a company called Augmetics that developed really the first augmented reality surgical device headset, so head mounted display augmented reality device that we can use for spinal surgery. And in particular, right now, it's FDA approved for spinal instrumentation placement. And there are other systems that allow us to navigate instrumentation placement in the spine, including robotic systems and something that we call traditional computer navigation systems. But what this device allows us to do, it's based on fighter pilot technology, and it allows us to be looking directly at the patient while we have an heads up augmented reality display of the CT imaging that we obtain intraoperatively. And then we can use that imaging to direct instrumentation into the spine in real time while we're seeing superimposed on that imaging where the screws are going into the spine. And so I was fortunate enough to be able to participate. My patient was the first patient to have that device used for placement of her spinal instrumentation. We performed a procedure called an L4 to S1 fusion and basically placed 6 screws in her spine under augmented reality guidance. We were able to do that successfully with all 6 of the screws. So in that case, it was a 100% accuracy rate. We were fortunate enough to be able to publish that case as the first case. And then subsequent to that, we've been able to use that device to continue to help additional patients since that time. So I'm very excited about this technology and what the future holds.
Great. One related use case is telesurgery. The idea is to have top surgeons such as yourself remotely monitor live surgeries that are taking place in a different location, a different state, or maybe even a different country, and provide expert advice to surgeons performing the surgery. What are your thoughts on this use case?
Yeah, I think that is a very exciting area. I would say that that sort of fits a little bit more into the world of kind of virtual reality, I guess, rather than augmented reality, which, as you know, is a little bit different. And I think that the scenario you described has great potential. I think it has great potential to help surgeons in remote areas that may not have the same luxury, if you will, as many of us in the United States have, to have the training and the resources to learn some of these techniques. And so I think being able to monitor that remotely would be a huge advantage and a big advancement for teaching and education. I would even flip it around a little bit. I would say that it might even be very helpful for surgeons in other remote areas or those to monitor. Let's say I'm doing a surgical case and they could learn from, the way that we do things. Now everybody does do things differently, and they could pick up bits and pieces of the techniques that we do or other surgeons use to then potentially gain confidence to then do procedures on their own. So I think it does hold some great potential with perhaps some logistic challenges.
Thank you, Dr. Witham, for sharing this. We at Ericsson are really working hard to get the hospitals ready for this future. We really want the hospitals to be prepared to adopt and scale many use cases like the one you mentioned, AR, VR assisted surgeries that can benefit from private 5G networks. We are also talking with the device manufacturer, like you mentioned, Augmedics, whose devices were used in the landmark procedure that you performed. What is your vision for the future? That is a future when the hospitals have embraced seamless connectivity.
Yeah, I think that this is an area where I think the possibilities are sort of limitless, and I think in medicine it's particularly it has particular potential, and not just even relative to the things that I do every day and the surgical procedures that I do every day, but I think having a connectivity across a broad range of even if we were able to connect completely across the United States, just things as simple as medical records, have an imaging depository. Not infrequently, patients come to our offices and we have to figure out, well, where did they get their MRI scan done? Um, they might forget the MRI. How can I look it up online? And often there are times when patient shows up, they forgot their images. I can't look at the images. If we're connected across all of the different, let's say, radiology centers across the country, where we just go to a imaging depository that, let's say, was connected through a 5G connection, like you're saying, we have access to limitless, basically everyone's imaging. We don't have to repeat imaging, that kind of thing. And that, I think, would save a lot of money as well.
Definitely, we can save a lot of money and improve patients' lives. Thank you very much, Dr. Witham, for your insights. We at Ericsson are really excited about your vision for the future of surgery. I'm sure your vision will inspire CIOs and other decision makers in the hospitals to prepare for this future. Thank you very much for your time. Really appreciate that.
My pleasure. Thank you.